We are a few minutes out from having done a Rhinophyma correction. For those people that don't know what that is, it's sort of it's an end-stage acne rosacea treatment, and this gentleman has been living with it for many, many years. It was just a bumpy contour, and I would say this is a brave gentleman for having finally come through and done this, and so I'm really happy we could do something for him. It was a combination for the procedure of both a cold knife resection of it, so that, and the real key with this, I've been involved with a lot of Rhinophyma situations in the past which were not as favorable due to really over-aggressive cutting with hot cautery. Actually, I didn't even use cautery. I had all the cautery set, but didn't even use it. And then I did what's called dermabrasion. It's not microdermabrasion, but dermabrasion, sanding down the edges just to blend in the areas better. And there's an idea of what's called subunit principle, which means I actually blended the whole nose so that the color and texture would be smooth and blended out. And we're going to follow this young man's journey this week, and he's been kind enough to try to talk to us about his story.
How are you feeling? How are you feeling?
I'm feeling really good, really good. The operation went very well.
Uh-huh.
And now my mom's moisturizing my nose. Just a little sore throat, but getting some lozenges for that. But
you slept quite a bit. That seemed to have helped pretty good. And actually, this ointment I think it's going to help you quite a bit because it's keeping it real moist. It's going to, and has to prevent any kind of infection, right? Well, you did pretty good. You slept like a rock. Pretty soon. How long did the doctor say it would take?
Take about 7 days.
About 7 days now?
Just to come off.
Oh, okay. 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 Are you hurting or anything? That's good.
No pain. That's awesome.
That's good.
Of course, the medicine they gave me has a lot to do with that, but everything's good, and it's been about, what, 6 hours?
More or less. More or less. Do you have any nausea or anything?
No, it's actually been about 7 hours since the operation. No, I have no nausea.
Okay.
Took the nausea medicine first, and then took the...
And then the pain pill, right? You did good. You did good. You slept real good, and that seemed to have helped quite a bit. Let's see. She said that as long as we keep it, it's very important to keep it moisturized with that antibacterial ointment, and it seems to be doing good. Just remember, don't get it wet, okay?
Okay, we're a day out. We just changed the dressing here because there was a little bleeding, and it may have been due to just normal events that can occur, but sometimes it could be due to aggressive bacitracin application. So just as a word of advice, just be really gentle. You can sort of see that I'm applying all this bacitracin to keep this zero form moist and really thick, but also being careful not to be aggressive with it. And I have this little extra piece right here to cover this extra side, just to let you know that there's a little thing there, okay? And that's it, just to show you how gentle we should be when we apply the bacitracin on. Good.
Thank you.
Well, we've arrived at a week, and this young gentleman is finished with his journey here, and we're just trying to show you. It's hard to see with the resolution on this camera, but everything went really well. There's these areas right here are still a little bit raw. It's normal. I've told him just to keep maybe 2 or 3 days more of some bacitracin, but everything else should stop. Up here, I dermabrated all the way to the edge because of the darker skin he has. I want to make sure that this all blends in so there isn't anything distinct. But it's healed really well. It looks good for a week, and I'm going to see him back in a few weeks, make sure he's doing well. And the lesson that I wanted to impart for you guys out there, this is a process, and it's so important that we don't just look at this as the final thing. I've erased a lot of sort of the end stage damage that's occurred from a surgical perspective, but just for those people that are sufferers of this condition, I just really want to make sure that they work with a dermatologist. I've emphasized this to this young gentleman, and he knows that that's an important element toward making sure this does not come back, it's maintained, and he does not go through this procedure again. So that's the real key with this, is maintenance, and it's right now. So I think I've emphasized it like 3 times. See your dermatologist. I'm not a dermatologist. I just play one on TV. No, I'm just joking. I don't do that. But anyway, so that's hopefully a good lesson about Rhinophyma, some of the end-stage acne rosacea and maintenance, so we can prevent this from happening again for this nice young man. Okay?